Health Network. It's contagious.
I'm not sure how I feel about rhinoplasty in a cosmetic fashion. I think that it's really important if someone were to break their nose or for some reason they can't breathe properly. I think then rhinoplasty would be a smart choice.
But then I worry that what if it wouldn't look good or it wouldn't fit my face, and I don't not like my nose enough that I would take the chance, you know what I mean? But I don't judge. I think it's awesome.
Maybe it's just a little shorter or like... Oh, hey. I'm just looking at my nose. What do you think? I mean, it's not a bad nose. It's not too big, it's not too small. It doesn't look like a pig nose, and it's not crooked or off-center, but I just, you know... Well, I don't have to decide right now. But if I wanted to make it more aesthetically appealing, all I have to do is call my local facial plastic surgeon and schedule an appointment for a rhinoplasty, which has nothing to do with rhinos or plasties.
A rhinoplasty is a medical term for a procedure that is actually involved with nose reshaping. Rhinoplasty is actually one of the most common and most elegant procedures we perform in facial cosmetic surgery. It involves changing the shape of the architecture of the nose, improving the function of the nose, and trying to get the nose to blend harmoniously into the features of the face. The goals are to provide someone with a long-lasting appearance that's natural, that gives patients the ability to breathe better, and also improves patient confidence, makes them feel better about themselves.
We often think of a rhinoplasty or a nose job as a surgery designed for the vain, but it's actually a useful procedure for anyone with a problematic schnoz. The nose, aside from holding up your glasses, actually has many important functions. You have to smell and breathe through it. On the inside, there are different structures that affect your nose's ability to humidify air. So if there's something structurally wrong with the nose, it can make any of these functions difficult. And if breathing is difficult, that's a serious problem, not a vanity issue. Despite its rather simple exterior, the nose is a complicated structure, and creating a new nose flawlessly is just as complicated.
Rhinoplasty is a very challenging operation from the perspective that it's a central feature. We can't leave any scars because it's in the middle of the face. We need to have a long-lasting appearance that lasts until, as long as you're going to be breathing through your nose, you want it to look good. And finally, we want the nose to, in addition to having a functional component, we want it to have a very we want it to blend in well with the other facial features and also with what the patient's ethnic ideal is of beauty. The challenges are adjusting the bones so that they fit, adjusting the cartilage, getting everything to heal properly, and making sure that it doesn't affect the function adversely in any way.
If you've decided to have a rhinoplasty, you will meet with the surgeon several times. The first is like a meet and greet where you and the doctor discuss your expectations and goals of the procedure. The second is to go over the rhinoplasty itself before you consent to the surgery. And then it's time for a new nose.
There's a variety of different rhinoplasty techniques. My personal preference is to do endonasal or closed rhinoplasty, which is a minimally invasive technique with no incisions on the skin. All the incisions are on the inside of the nose and the mucosa, and we just remove only the amounts of cartilage that are necessary to improve the appearance. And then if the nose has asymmetric nasal bones or uneven nasal bones or irregularities, then yes, we can either shave the bones down or occasionally, very occasionally, break the bones so that they are actually narrower and they blend in with the rest of the face.
Following the surgery, you'll go home with a nasal splint or a nasal bandage. There shouldn't be too much tenderness, but you may have some bruising under the eyes and some swelling that can last anywhere from 2 weeks to 2 months. But there's no need to worry about the side effects because your facial plastic surgeon will be checking up on you along the way.
After the surgery, I like to see my patients on a 1-week, 3-week, and 5-week basis to make sure that everything's healing properly. With rhinoplasty, the number one issue is making sure that the bones and cartilage are healing the way we want them to, and to make sure the skin is redraping nicely over the new architecture of the nose. And sometimes in some patients, particularly patients with thicker skin or some of our ethnic populations, that can take longer. And the doctor has to be prepared and have some experience in dealing with that.
Well, nose, I think you're here to stay, at least for a little while. I'm Dr. Keller Wortham, and you're watching the eHealth Network. Stay healthy.
eHealth Network brings you this movie trailer.